trust me when I say, let's not use that one, or use something different. So I'm excited to.
I didn't have any symptoms as far as the lung cancer is concerned. Felt like I was pretty healthy. Started having some abdominal pain. So when they do that abdominal scan, they clip part of the lung, the lower part of the lung, and when the scans came back, nothing wrong with my abdomen, but they saw the tumor on the lower part of my left lung. Since I had had those abdominal scans 2 years earlier when I had that other condition, they were able to compare that scan to the one 2 years earlier, and where there was just sort of a non-conspicuous shadow 2 years earlier, now there was a clear tumor in my lung. It was totally an accident, a godsend, a circumstance, whatever you might view it. It was a blessing in disguise to have had that abdominal pain, to get the scan and find the tumor.
Hugely lucky, because again, for a lifelong non-smoker, no one would usually be, pushing to wind up getting any kind of CT scans or imaging of the chest.
The tumor was cancer. This really isn't real. I've dealt with family members and friends who've had cancer, but not me. I made a few calls, got in to see Dr. Lackner, and was thrilled. He was so careful in his communication, very personable. So additional tests to make sure that it hadn't metastasized or shown up anywhere else, and then surgery to remove that part of my lung.
Just having it picked up before she had any symptoms, she turned out to have early stage disease, and so didn't require any chemotherapy or radiation after the surgical procedure.
The thing that struck me, and I think it was either when I had gone into the hospital for the surgery or right before, was the tagline, which is "Serious Medicine, Extraordinary Care." And I think that my experience is kind of summed up in that. Folks at the check-in desk, the nurses, the technicians in the scans and the x-rays, from top to bottom, just so caring. I think that part of it's they know that the patient's going to be anxious, and I had some anxious times, and it's scary and all of that. And every single person helped me know that they were going to take good care of me, and that I was going to get the very best care, and that's exactly the way it was. Fortunately, there was no additional signs of the cancer. Anytime I kind of feel weird or have a question, I can call, and they don't say, "Oh, don't worry about it." It's let's check it out, and that's really encouraging. 8 months after my surgery, my dad died. And so I was at the visitation, and one of his friends said, "I hear you're a cancer survivor." And I thought about that, and I thought, that's really cool. I think I'm going to claim that because it may come back, and I understand that. But right now, I'm cancer-free, and I'm a cancer survivor, and I owe that all to Nebraska Medicine.